Hello and welcome back to the Healthwise channel, your ultimate guide to living a healthier, longer life. Today, we're tackling a topic of critical importance, one that could save your life or the life of a loved one. When you think of a heart attack, you probably picture someone clutching their chest in intense, crushing pain, just like in the movies. But the truth is, this classic symptom is not the only warning sign. In fact, many heart attacks present with subtle, hidden symptoms that are often dismissed or misdiagnosed until it's too late. These are signs you should never ignore. Today, we're going to unveil the 10 hidden heart attack signs that are often overlooked. Especially in women, older adults, and people with diabetes, this information is your best defense. If you ever suspect you are having a heart attack, the first and most critical action is to call 911 or your local emergency number immediately. Do not wait. This video is for informational purposes to help you recognize the silent warnings. Let's begin this life-saving discussion. Before we dive into the list, it's essential to understand what's happening during a heart attack, or myocardial infarction. A heart attack occurs when the blood flow to a part of the heart muscle is blocked, usually by a blood clot. Without oxygen-rich blood, the heart muscle begins to die, while a complete blockage often causes the classic severe chest pain. A partial or temporary blockage can lead to more subtle, less recognizable symptoms. The body's nerves, particularly those connected to the heart, don't always send a clear signal of pain to the chest. Instead, they may transmit pain signals to other areas of the body, or cause less obvious symptoms like fatigue or nausea. This is why a heart attack doesn't always feel like a heart attack, and why listening to your body's subtle warnings is so crucial. 1. Unexplained fatigue. This is one of the most common and easily dismissed hidden signs. Particularly in women, you might feel a sudden, overwhelming, and debilitating fatigue that has no clear cause, such as a lack of sleep or physical exertion. The American Heart Association has highlighted that extreme fatigue can be a sign of a heart attack, as the heart works harder to pump blood through a blocked artery. This can drain your energy reserves and make even simple tasks feel exhausting. If this fatigue comes on suddenly and is not related to your activity level, it is a red flag you should not ignore. 2. Shortness of breath. Without exertion, feeling short of breath after a run is normal. But if you're suddenly struggling to breathe while simply sitting down, walking to the mailbox, or even lying in bed, it could be a sign of a heart attack. The heart's inability to pump enough blood can cause a backup in the lungs, leading to difficulty breathing. A study published in the Journal of the American Medical Association found that shortness of breath was a common symptom in women experiencing a heart attack, often without any accompanying chest pain. 3. Pain in the jaw, neck, or back. While chest pain is the most famous symptom, pain can radiate to other parts of the body. You might feel a dull, aching, or pressure-like pain in your jaw, neck, or upper back. This is because the nerves that serve the heart and the nerves that serve these areas are closely linked. The pain can be confused with a pulled muscle or a headache. But if it comes on suddenly and is not relieved by rest or a change in position, it could be a sign of a heart attack. 4. Stomach pain, nausea, or vomiting. A heart attack can sometimes feel like a bad case of indigestion, heartburn, or even the flu. The pain may be centered in the upper abdomen, accompanied by nausea or vomiting. These symptoms are especially common in women and are often mistaken for minor stomach issues. The reason for this is that the nerves connected to the heart also connect to the digestive system. A study from the American College of Cardiology noted that atypical symptoms like these are a frequent cause of delayed care in heart attack patients. 5. Lightheadedness or dizziness. Feeling suddenly dizzy or lightheaded, as if you might faint, could indicate a heart attack. A heart that isn't pumping blood effectively can lead to a drop in blood pressure and a lack of oxygen to the brain. This can result in a fleeting sense of confusion or a feeling of being unsteady on your feet. While it can have many causes, a sudden onset of lightheadedness, especially when combined with other symptoms, is a reason to seek immediate medical help. 6. Sweating, without a clear cause, breaking out in a cold sweat for no apparent reason, such as exercise or heat, can be a subtle sign of a heart attack. When the heart is struggling, your nervous system triggers a fight or flight response to cool the body down, leading to profuse sweating. This is often described as a cold, clammy sweat. This symptom is particularly common in women and should never be dismissed as simple stress or menopause. 7. Swelling in the feet, ankles, or legs. While swelling is often a sign of chronic heart failure, it can also signal an impending heart attack. When the heart is not pumping efficiently, it can lead to a buildup of fluid in the body's tissues, particularly in the lower extremities. This symptom is often overlooked as a side effect of aging or standing for too long, but it's a warning that your heart is under significant strain and requires attention. 8. Persistent cough or wheezing. A persistent cough that produces a pink or white mucus-like substance can be a sign of heart failure. A weakened heart can cause fluid to back up in the lungs, leading to a heart cough or wheezing similar to that of asthma. This is a clear indicator that your heart is struggling to keep up with the demands of your body and requires immediate medical evaluation. 9. Indigestion or heartburn. This symptom is often the reason people delay seeking help. The burning sensation in the chest or abdomen can feel exactly like heartburn, but it's crucial to differentiate. Unlike typical heartburn that is relieved by antacids, heart attack-related indigestion often worsens with physical exertion and may be accompanied by other subtle symptoms. When in doubt, it is always safer to assume it is a heart-related issue and seek emergency care. 10. Anxiety or sense of doom. A powerful, unexplainable feeling of anxiety, impending doom, or panic can be an early warning sign of a heart attack. This is especially true if you do not typically suffer from anxiety. The body is an incredible system, and it can sense when something is wrong. A study from the Mayo Clinic highlighted that a feeling of intense, unexplained anxiety can be an atypical symptom of a heart attack, a signal from the body that something is critically wrong. It is a well-established fact that women are more likely than men to experience these hidden or atypical heart attack symptoms. While men often report the classic chest pain, women are more likely to experience fatigue, shortness of breath, nausea, and jaw or back pain. This leads to a dangerous delay in diagnosis, as both women and their healthcare providers may mistake these symptoms for stress, anxiety, or other conditions. Furthermore, older adults and individuals with diabetes may have nerve damage that dulls the sensation of pain, making them more susceptible to silent heart attacks with very few, if any, recognizable symptoms. Being aware of these demographic differences is a critical part of a complete understanding of heart attack warning signs. Your best defense against a heart attack is twofold: prompt action and proactive prevention. If you or someone you know experiences any of these symptoms, do not hesitate. Call 911 or your local emergency number immediately. Do not try to tough it out or wait for the symptoms to pass. While you wait for help, stay calm and rest. And remember, the most effective way to prevent a heart attack is to live a heart-healthy lifestyle. This includes a balanced diet rich in fruits, vegetables, and whole grains, regular physical activity, managing stress, and avoiding tobacco. By taking care of your body and listening to its every signal, you empower yourself to live a longer, healthier life. In conclusion, a heart attack does not always look like it does in the movies. The hidden signs, from unexplained fatigue to jaw pain, are just as real and just as dangerous as chest pain. Your body is a finely tuned machine, and its signals are your most important warning system. Learn to listen and trust your instincts. Remember, every minute counts during a heart attack. Your swift action can be the difference between life and death. If you found this information valuable and empowering, please give this video a thumbs up and share it with your friends and family. This could be the most important video they ever watch. And don't forget to subscribe to the Healthwise channel and hit that notification bell so you never miss our next life-saving health guide. Thank you for watching. Stay safe, stay healthy, and I'll see you in the next video.